But we'll get right into it. There will be some time for some question and answers at the end of the session. But if you do have a pressing question, feel free to throw it in the chat and we'll try to get to it. Or kindly ask that you put your hand up. We do kindly ask that you just remain muted throughout the call. And again, just if you want to ask a pressing question, just toss it in the chat or raise your hand and we'll kind of call upon you. But yeah, we'll kind of get started. One of the first things we kind of have on the agenda to talk about is kind of just the mental shift, from being a med student to intern year, and known as being one of the most grueling years of residency. I know I myself am kind of in that awkward position where like I'm done medical school and I'm technically a doctor, but then I haven't really started residency yet. And, I just have this like weird gray area kind of time right now. So Matt, what are things, or things that you wish people had told you, before intern year that could have helped you better mentally prepare for intern year?
Yeah, I think the biggest thing I, wish I knew or someone told me is just kind of give yourself grace. There's that first like 6-month grace period where honestly, you're probably not going to retain any information that you learn there. It's very new, like you learn everything is new. You're learning a new EMR system if you're not used to whatever EMR system you're using. For us, it's Epic, which was like the first time I was using that. You're learning a new state. If it's a new area for you, you're learning the culture within that residency program, which is also different. You're learning, nursing staff, you're learning new med students, you're learning residency, your colleagues, and then also your seniors, your new attendings, those kind of things. And honestly, at least from an internal medicine standpoint, medicine is so broad. And I thought I knew pretty much like everything, just, tutoring and stuff like that. But man, it's so much more detail. You actually start realizing that it's not what you necessarily read in a book that you're actually doing for patients. And some of the first line things that you thought would really be first line are really like last line. Those zebra things that you guys are used to remembering and all that's like, you very rarely see that, it's usually just like it's not, I'm trying to think of like some weird pathology, but yeah, it's nothing on like sketchy micro or anything. It's just probably COVID, and that's, so I think that's, giving yourself grace is very important. The other thing I would say is just give yourself time to learn, understanding that it's not all going to come at once. It's, for at least internal medicine, it's 3 years for a reason. And you're not going to learn all that in your intern year. I'll be honest, at the end of my intern year, I still didn't feel super comfortable even approaching my senior year, second and third year. I'm trying to think, man. Yeah, it's you're going to put in some long hours. For the most part, like for us, we do most of our night shifts our first year. So a lot of sleepless nights. You might not get to see your loved one as often as you usually do, or your dog or your cat, or family, those kind of things. And it can be depressing. And that's, that's part of it, unfortunately. But another thing is I say, try and find someone that you can lean on, whether it's a colleague at work or whether it's your spouse or whatnot. For me, it was, like my faith and working out. And I have a lot of friends outside of medicine, which also was beautiful because nothing worse than coming home and talking more about the thing that's stressing you out the most. So I would definitely say that a lot of Netflix binge watching, it was helpful, those kind of things. And then last thing I would say is like when you're off, be off, man. Like have a good work-life balance relationship. I know it's hard at first because you want to learn all these things and you want to study, you want to be the best, you want to show that you're, especially if you're an IMG. I feel like for me personally, like I felt like I had an extra thing to prove outside of my US colleagues. But you guys are all there, you know what I'm saying? You guys are all qualified. So when you're off, man, turn your phone off or, turn your Epic or whatever you EMR system off and enjoy life. So.
Right. On that note of you were saying like, it's going to take the full time to learn and all that stuff. What is the actual expectation? Like day one intern year, are you, like, how much are you expected to actually know? How much are you expected to actually be a doctor? Like, what would you say your read on that was?
Yeah, for me, honestly, they set the bar low for us. It was just show up on time and smile. That's kind of all that really. And honestly, I think that's all you really can expect out of your interns, to be honest. And like I said, they're there to teach you. That's literally what residency is all about. Like that, you just, as long as you show up and you have a good positive attitude and you're willing to learn, I think that's all you really need, honestly.
Okay, so was there like this expectation that like, hey, like I should be studying a lot of like XYZ before like my first day of residency or even like my first week or month of residency? Because one of the biggest things that I'm trying to do is have like a central line kit, and I'm like, oh, like let me make sure like I'm practicing with this, and then obviously like everyone has their suture kit, and like in ER you have to do it all the time. So I'm like, oh, like I wonder if like some of this is like overkill, if it's like, hey, you know, you have those 2 weeks before residency, and most residencies at least, where you can kind of train before. So I'm kind of like, I've heard a lot of mixed feedback as to whether it's like, hey, just enjoy your like time off, like you'll get accustomed, or if it's like, hey, you should do at least a bit of like studying before.
No, that's a good question. And like you said, man, you're gonna get it. It's a mixed bag. Like whoever you ask is gonna give you a different answer. For me, I think at least what our residency program was always harping about was just passing your boards. Like your step 3 was like super important, because if you don't pass your step 3, you can't advance to your year 2 and 3, you know? So that was pretty much the biggest thing. Like they were just like, hey, study, get your UWorld out the way or your AMBOSS or whatever. And then take it early if you can, and then pass your board. And then from the rest, they'll take you from there. I would say from an EM standpoint, I think knowing like a little hand chop method and, you know, the ties and all those kind of things, maybe that might help. But for the most part, I mean, even central lines, you guys are going to get, hopefully you get orientation, and you'll go to like the sim labs, those kind of things where you can practice central lines, thoracenteses, those kind of things, intubations. So like allow them to teach you is what I'm trying to say. So all that to say is, you know, you can do some basics, but for the most part, man, I would say 90% have fun, 10% maybe study here and there, those kind of things. So
okay, that's good to hear. That's I like that.
Yeah, and you're probably going to forget it, honestly. Like, I'll be honest with you, you're probably all that studying, and I did it with myself too. Like, I had a whole book that I studied, and then, dude, I didn't remember any of that. Like July 1st, I was like, "Where's the bathroom?" And like, I didn't know what was going on. You know, like it's like the little stuff that adds on top of each other. So it's a waste, I think. But whatever you want to do.
That's good to know.
I feel like I'm already kind of starting to forget stuff, which is not really the best feeling in the world. But I know, kind of touching on some of those things that we could do to prepare, how much of that do we actually do during like orientation and stuff?
Yeah, each orientation is going to be a little bit different. But for us, I think we did a lot of simulations in terms of like we call them like rapid responses or code blues, essentially like figuring out how to manage those acute patients. The other things were just onboarding things, man. Like, you know, just make sure you have your vaccines updated, and make sure your program sends your board scores and those kind of, and like doing a whole bunch of modules and those kind of things. Even like learning the hospital, to be honest, that's really all it is. Medically, like there was really not big education. Like I was just more like figuring out what Epic's like, making my own patient chart and like customizing it the way I wanted it. Those kind of things. I don't think we really did a lot in terms of, you know, like how do you treat pneumonia? How do you treat like COPD or heart failure or whatever? Like that stuff's going to come in. And we'll get into like the resources that I use for that. But yeah, absolutely. They'll tell you the resources that you need to use in order to study those things on your own.
Okay, cool. And then speaking of orientation and just like, you know, prep for residency, right now, I know I can speak for Alan too when I say like we're in this point where we're like bunch of paperwork to do. You know, I'm also a non-US IMG, so I'm also trying to deal with like visa stuff. And there's just like small things that I know I'm about to get, like, you know, little modules on how to use Epic and the EHR and stuff. What do you think is absolutely necessary to make sure you have, you know, done and out of the way, you know, for day one of residency? Because I'm hoping to try getting, you know, everything banged out so that once residency starts, I can just focus on that. But inevitably, you know, I feel like there's going to be delays with stuff, with like even just like moving in and getting furniture and stuff like that. So what do you think is like, you know, make sure you get this done before day one for sure?
I mean, for me, it was nice because I actually graduated that December while we were applying, and then you obviously find out in March where you're going, and then you start, you know, July 1st. So I had taken my step 3 right after graduation. So around like that March, like around this time, honestly, before I actually started, which was nice because I didn't have to study like my other counterparts when they would have like days off, quote unquote. They would really just be taking that day to study and those kind of things. And so I didn't feel that pressure. And I couldn't imagine going through intern year. It's obviously doable. I'm not trying to scare you guys, but like it is obviously doable. But I felt like it was just an added thing that was just like that lingering, that buzz, that mosquito in your ear that just like kept annoying you and like, oh man, I'm finally off. And then it's like, oh man, I got to go study. You know, I got to do 10 questions or whatnot, those kind of things. So, I mean, if you can get your boards cracked out as soon as possible, I definitely think that's, you know, I would highly recommend that. In terms of that onboarding stuff, that's that mundane stuff it's always going to be around. I'm doing that stuff right now for a fellowship, your licensing, all that kind of thing. So I would say take it in chunks. You know, if you have, you know, just do like maybe 10% one day, 10% kind of go from there. I would definitely say have most of that done before you actually start moving, because then, you know, next thing you know, you're like, oh man, I need vaccines. That's at home. I'm back. I'm already moved in, those kind of things. So just try and get all that out the way. Background checks, those kind of things. Your modules, those are also very annoying. I'm not gonna lie. I skip through most of those if I'm being honest. Or like I'll look on, I think Reddit or something online. They have like usually like the keys or whatever for most of those modules. So I'm not condoning that, but I'm just letting you know that you know, if you
Take that with a grain of salt.
What else? Yeah, honestly, onboarding stuff, step 3, and then getting moved in like as soon as possible. So that way you can get the lay of the land very early. I'd say would be like at least the 3 bare minimum things you should do.
Yeah, no, that's fair. And oh yeah, go ahead. It was, I think, Fabian.
Fabian, do you want to ask your question?
Oh, no, it was a mistake. I'm sorry. I'll work. I'm listening.
No.
Thank you.
Okay. Yeah, I was gonna ask, Matt, like, what are some of like the financial or like logistical pitfalls that people oftentimes will be like when they first start out residency? Like, one of the biggest things like I just did about like 2 months ago is I just got a new financial advisor. Just because there's just, you know, obviously there's loans, there's a lot of moving and relocating. I'm literally relocating across the country. So yeah, I'm kind of curious to see like what are some of these like financial like pitfalls that you sometimes see for new incoming like residents.
Yeah, no, I mean, honestly, you're already ahead of the game. I think for me, I kind of having my business kind of made me already get my CPA and those kind of things. So taxes is another thing. So you actually might start making more positive. So you actually might start paying taxes. You guys don't realize that yet. You know, like not too much, but still, you know, you're not going to get money back, if you will. So that would be another thing. You know, if you have a financial advisor, that all the better. CPAs, those kind of things, people who can kind of at least talk to you about things to expect moving forward. You know, insurance is very important. And that's really more so talking with your specific program that you're talking, because they'll help you set all that up. But just getting in contact with the right people and saying, hey, you know what, I'm big on my teeth and those kind of things. So I had to get dental for sure. Hearing, I didn't necessarily care about. Eyes, I didn't necessarily care about, although I'm kind of blind. I need to get that. Like the little minor things. Therapy was also very important, like those kind of things. Making sure like mental health is included in your healthcare package. But yeah, I think honestly, bare minimum financial planner or like a CPA would definitely be what I would definitely recommend. And honestly, man, don't like the first month or two, try not to spend your money. Like just see what it looks like, because I remember myself like going from paying this program, you know, you pay your school however much money to now you're making a check. And you're on your own, your parents aren't around, and you're like, man, I'm about to spend all this money on Chipotle, you know, and so like that. So hold that money, you know, definitely you have a little bit of fun every once in a while, but yeah, try and hold that money and just kind of see that first month's expense. So that way you kind of get an idea of like, okay, these are what my utilities are like. This is what rent is going to be like. This is how much I have left over at the end of the month. So then I can sort of coordinate and say, okay, well, here's a little bit more spending money. I can get a few more Chipotle burritos, those kind of things. So, yeah.
Yeah, I like that.
Yeah.
Yeah, I feel like I could already kind of, I just secured where I'm going to be moving into, and I feel like I can already feel like the expenses looming and stuff like that. So I know it's something Al and I talk about all the time. So I'm making sure I budget some comfort room for that first couple months, especially.
Absolutely.
I wanted to ask a question about STEP. I know you talked about the importance of getting that step 3 done, but you know, I feel like in med school, it's very basic to come up with a study plan. Like everyone says do a 4-week or 5-week. You go all over Reddit, you can find like a good study schedule. Obviously in residency it's different because you're studying on top of working like 10 to 12 hours daily. So I'm kind of curious, is there like a standard like plan for studying for step 3 during residency? Like is 4 weeks kind of like an average period people take? Is doing 10 questions a day kind of standard? Is doing 100 questions a day kind of standard? What is that kind of sentiment like?
Yeah. I mean, that's a good question. I mean, and honestly, again, like I keep saying this, but like the answer is going to depend on who you are as a person. I think knowing your study habits and knowing your study patterns and knowing your study weaknesses, I think are very important before you even begin studying for, any of your board scores or boards in general. For me, I was already tutoring at the time, so it was very easy. And step 3 is essentially, it's a 2-day exam. And I can't remember how many numbers off the top of my head, but the first day you're essentially just doing questions, and it's a good mix of like step 1 and a little bit of step 2 questions. And then that second day you're doing something called a CCS exam, which essentially these are like, it's honestly like a clinical scenario. It's almost like a video game. And like you're either in the hospital, you're in the emergency department, or you're at the clinic, and a patient's basically coming into you for like a chief complaint, and you have to put in the right medications, the right orders, those kind of things. It's essentially what your intern year is all about. And it's that part is, I would say, the difficult about, step. Just because like we've never done that before. You can study, all you want, but you've never actually done that, so I would say, for that, I spent a little bit more time studying. So I think it's ccscases.com, if I remember correctly. And I'll try and write all this in the chat later on, but that I felt like was a good, almost identical to what my board, like the simulation that was actually on my step. It was a good help and prognosticator of like how I was going to score my actual CCS cases. And then like that, after your CCS cases, then you have like another few questions to do or whatever. So kind of getting a long-winded answer, getting back to what you're saying, I think bare minimum, I think you should at least complete like maybe half of UWorld is what I would recommend. I think anyone who's at least completed half has generally done well. And I wouldn't rush it. I wouldn't do like, like last week, you would just do all of your UWorld. I would definitely say space it out a little bit more. Give yourself at least, for me, it's always 4 to 6 weeks, like bare minimum, I would say. Is like a good time. And that's honestly what a lot of the studies are showing, that we retain most information within that 4 to 6 week period. So yeah, whether that's 10 questions a day or whatever you want to do, Anki, or however you like to learn. If you're a visual learner, YouTube videos, those kind of things. I think Beyond the Boards or like Online MedEd or something like that, they have like some step information. If you're an auditory learner, I know like Divine Intervention, he has really good podcasts. If you need actual tutoring, obviously hit me up. We do tutoring. I'm trying to think of some other way. It just depends on how you learn, like tactilely. So I would definitely say 4 to 6 weeks is what I would definitely say. And at least bare minimum, get half of UWorld in.
Right. And you said it was 2 days. Is the scoring, is it even for the 2 days, or is the second section a lot more heavily weighted, or?
Yeah, I mean, I'll be honest with you. Step 3 for a lot of people is more just like, man, just pass it and get out the way. So I think at first that was kind of how I was looking at it, to be honest. As far as the weight of the actual score, I don't know if like CCS cases weigh more than the actual QBank or short questions. Off the top of my head, I'm not sure. I can find out for you though and put it in the group chat a little bit later on. But yeah, I don't know. Obviously, you have to pass both though. Like it's very important, because if you don't, I think you have a certain amount of fails on the CCS cases. If you don't, I don't think you actually pass the step 3, even if you do well on the question. So it almost sounds like it's evenly weighted.
Yeah. Would you say like UWorld and Anki was probably like the top 2 resources you use?
Yeah, I personally was not an Anki fan, to be honest. I didn't like it. All that to say is my counterparts loved Anki, and we all got around the same scores. So I had some friends who would just do Anki, never did UWorld. I was a guy who just did UWorld, never did Anki, and we all did well. I have some friends who did a mix, it honestly just depends on how your learning style ultimately.
Yeah.
Mookie's a good resource. There's some good decks out there. I think Reddit always has some good decks that you can kind of review. And then I think I always recommend making like at least a personalized deck, which is essentially I would do my UWorld, whatever I missed, I would make a card out of it. And I did that honestly starting like when I was in clinicals. So I really didn't have to go back and study anything. I just kind of studied from my missed deck pile and then just did my UWorld. And that was all I had to do, to be honest. But everyone's different.
Yeah, and when you were scheduling like step 3, did you have to kind of like coordinate that with like a residency like director or like a residency coordinator, or was it kind of like, hey, at any point in time, like you can just choose at will, like when to go ahead and kind of like schedule that?
Yeah, so I mean, unfortunately, fortunately, I took my step before I even started residency, so I didn't have to have any of that, trouble.
Nice.
But talking with my colleagues, that was something that they did have to talk with like our chiefs about, because our chiefs make our schedule.
Okay.
They would say, hey, I'm planning on taking step around this time. Can you make my schedule a little bit lighter? We'll do, electives, those kind of things where I can kind of be at home and study, virtually or whatnot. So I think communication is very important. That's another thing I would say, like, you guys got to get really good at just communicating with your colleagues and even your seniors and attendings. Let them know, like, hey, man, I got this thing coming up and I at least want a week or two to study for it. And usually if you let them know far enough in advance, for the most part, I feel like everyone's going to be like, hey, I respect that, and then they'll give you the time. So.
Right. Is there ever a sentiment of like, try to use your vacation to study? Because I know we have like 2 blocks of 2-week vacations, and I'm hoping to, when I go on vacation, to not worry about any of that stuff. So is there ever kind of like a push to like, oh, like you should take your vacation before you write? And
yeah. Again, me, I'm a work hard and play hard kind of guy. So like my vacation was my vacation. So I'm not studying.
Yeah.
No, like that's not part of it.
Yeah.
So for me, I know some people who have taken vacation and like they would take in their boards around that time. Again, keep saying it. Everyone's different.
Right.
For me, I'm not doing that. I was like, no, I'm going to Hawaii. I'm going to Turks and Caicos, and I'm not studying. I'm not bringing my books, those kind of things. I would definitely say we have a Jeopardy system. So it's like if we call off work, another person has to like essentially fill in for us. So it's nice when you can plan it around. So I would let someone know like, hey, I'm probably going to call off work, or can we do like a planned Jeopardy? And I'll just call off these 2 days. And then when I'm back, I'm on Jeopardy. You call off these 2 days, and that way kind of pay back. That's like another way you can kind of do it.
Right.
If the chiefs aren't necessarily letting you get the days that you want. So there's ways around everything. Honestly.
Yeah.
But yeah, I honestly would find a good 2 days that you're not on a very hard rotation, and then do those 2 days. Usually weekends or something like that if possible.
Right. I think we have a question in the messages. Does step 3 score matter at all for fellowship applications, or?
Yeah, I mean, I would say it's like on the lower end of importance. I know pretty much the primarily thing that matters is usually your letters of recommendation, your achievements during residency, and honestly the interview itself. Once you get the interview, it's all like a personality check. For me, I scored well on my step 3, so I guess maybe that's why they didn't really ask me about it. But I don't remember anyone being asked in any specialty like talked about their board score, like their step 3 scores. And I know I have friends who didn't do well per se on their openly, they didn't do well on their step 3. So, and they never mentioned that any program director talked to them about it. But I'm sure maybe it goes into, I'm sure like if you don't score well, you're probably not going to get into Yale. But like, say la vie, So.
Yeah. What would you say is like probably the biggest challenge that you faced in intern year?
Yeah, man, I think that's a good question. Biggest challenge. I think like learning how to be a part of a team was very difficult for me. I'm very independent and I like to do things my way. And I don't really like people looking over my shoulder. And I don't like reporting to people, those kind of things. But that can only get you so far, because at the end of the day, you have to realize that you're treating patients now. Like, it's not about what you feel is important and those kind of things. Like, it's ultimately about someone's loved one in a life. And so you have to learn to adapt, however that looks for you. You might be someone who loves to work in groups and loves to rely on others. And then there's going to come a time where you're by yourself and you're on nights and you have to make a decision. So you have to learn to adapt. So that would be the biggest thing I would say. It's just like learn how to adapt to fit the situation that you're in and to ultimately take patient care as your priority. So yeah, and like I said, just expose yourself to different scenarios. It's going to be uncomfortable, man. Like that, it's
Right.
learn to be comfortable with the uncomfortable, because that's the best way you learn to thrive and you become the best clinician that you can in those scenarios. If you're afraid of something and you never approach it, it's going to haunt you for your whole year, like all 3 years or however many years you're doing of residency. So definitely get involved into it.
Yeah, no, that's fair. I like that.
Nice. This might be a bit of a vague question to ask, but I was talking to one of my mentors pretty recently. He's a resident as well, and he was telling me one of the most important things that mentally I'll have to take on in intern year is kind of shifting the mindset from you're a medical student to like you're a doctor and these are your patients and you sign for this.
Mm-hmm.
How do you go about taking on that mindset shift? Any tips, any tricks? I know it's a hard question to answer.
Yeah. And you have to learn to take ownership. And you're right, it is pretty vague, but you'll understand when you get there that like these are actually your patients. It's no longer like, let me see this patient and then like write a nice HMP and then like ask the resident, like, can I do anything else for you? And then you leave. You know, like it's no longer that anymore. Like your notes count. Like people are relying on your notes to actually plan patient care, which is very important. Like the nurses care about your notes. Like if you write something like give this patient, 20 of Dilaudid, they're going to give that patient 20 of Dilaudid. Like you can hurt a patient if you're not, careful. Again, not trying to scare you guys, but like all I'm saying is like it's very real now. And you have to do the work. You have to stay late sometimes for patients. You have to follow up. It's not just like putting in orders and stuff. You have to follow up with these patients. You have to see if your management's working, and if it's not, you have to pivot, right, and learn and try something else. You have to learn you have to learn like you have to create like a network in terms of like, hey, I know if someone's like if they're bleeding, I'm going to call interventional radiology. I have a couple friends in interventional radiology. Learn how to network. That's also super important. Something I didn't really do in med school. I was just kind of like, all right, I'm part of the group, and then I would leave and go home and play video games or whatever. Like, no, like you stay here, like learn everyone's name, learn who does what, learn who's good at what, and go from there. But yeah, just definitely taking ownership is honestly ultimately what I would say. That thing that you have to learn.
Right.
And
yeah, that's great advice. I think that definitely, I feel like I'm like mentally starting to prepare for that, but I feel like you said, once I get there, I feel like it's just going to hit me like a bus.
Yeah, it will. I mean, and like I said, it's you're never, I honestly, personally, I hate to say this, but like, I don't think anyone's ever going to be ready for intern year. Like, it doesn't, like I have an intern now. He did like 20 something years of nursing school, like nursing before he went to medical school and started. And he still was nervous going in, like, it's just like he has more clinical experience than I do. And he even was like, man, it's different now. Like, I don't know what this kind of, I don't know where to put my hands, like those kind of things. So, yeah, I mean, there's going to be a little bit of discomfort and those kind of unease, but like ultimately, man, like you guys are going to thrive. Like just keep at it, keep studying, those kind of things. Keep asking questions. I think that's another thing. Like never feel like you know something too well. That's how you miss something and you hurt patients. Always ask questions. Always, always ask questions ultimately.
Right. One more quick question, and then I think we could shift to an open floor here. But I think one thing that is overlooked a little bit is also, being a resident, you're now kind of getting into a role of also being a teacher and a mentor to, other med students that you're now going to work with. Can you speak to a little bit about that and your experience in intern year and, mentoring and being there to help med students out?
Yeah. I mean, I see even now, I'm older. I guess I'm older in the game is what I think my interns tell me. But I still see myself as a med student ultimately. Like, I think med students, like, we're there to learn. We're there to ask questions. We're there to mess up. And then we, learn all over again and try it all over again. So I see myself still as like a medical student in terms of that. So you also have to realize that you now have a lot of power and a lot of, you're now at a point in your life where you've always wanted to be since you started day one of medical school. Since that white coat ceremony,
right?
Imagine yourself where you're about to be right now.
Mm-hmm.
Nice. And so I want you guys to just remember that and like ask yourself, what would you have wanted to know like when you were in that position? And so like you're going to see a lot of like wide-eyed med students like day one. They're like, Roche, what do I do? Like,
yeah.
And you're probably gonna freak out too, like, I don't know, dude. Like,
yeah.
but like, yeah, man, like it's such a cool experience. I love mentorship. Like I thrive on mentorship. And I think it's very important because I've had such good mentors.
Right.
And I've always wanted to pay that back.
Mm-hmm.
I will say this, you really don't know what you don't know until you have to teach it to someone else. Right. Like you could say, I don't know, like gluconeogenesis all you want until like another student's like, hey, can you teach me that or write that on a board? And you're like, I don't know how to write that. So you really don't know. So it will help. Mentoring will help you as a clinician in itself.
Right.
Be honest with your students. I think that's also very important. If there's something that you don't know, it's okay to say like, I don't know. Find out, we'll look it up together, those kind of things. Try and be nice, smile. I know it's a tough place. You're going to probably be grumpy sometimes, like after sleepless nights. But just like I said, try and just be passionate to those students. And they're ultimately there to ask questions, and they want to help as much as possible. Just like as we all were trying to be helpful and those kind of things. So just kind of things. But yeah.
Oh, that's awesome. I really like that. We want to go ahead and kind of open the floor to anyone who may have any pending questions. I know we kind of covered a lot of topics. We want to kind of open the floor to you guys and see if you have any specific questions that you would like to ask.
All right, I can go first. That's fine.
Go for it.
All right, my name is Bright, matched at Nashville for anesthesiology. I just have a quick question. One of the things I noticed throughout med school is I'm the kind of person who's always very open to talking about my failures or like being very comfortable saying, like, I don't know what the answer is, like, but I'll surely figure out a way, get the answer. But then how do you balance being in residency and being comfortable saying, I don't know what the answer is, but also not trying to, create this perception of yourself that you don't really know anything? Because like, if you just keep on saying, I know what the answer is, I know what the answer is, I feel like people try to see you as a person who doesn't really know what's going on.
Yeah.
How do you find that balance between being comfortable saying, I don't know what the answer is, but then also saying, oh, this person's actually knowledgeable, but they just don't know what the answer is now. They'll figure it out. How do you feel that?
Yeah, that's a good question. I'll be honest, personally with myself, man, I really don't care what I truly don't care what other people think about me. So like, I know no matter what I do, there's going to be a 50% of people are going to think I'm smart. No matter what, I wear glasses, so people go like, "Oh, that guy is smart," And then 50% of people, no matter what I do, they're gonna be like, "This guy's dumb," So like, it really doesn't matter. I just want to put that out there. But getting to your point, I think early on it's normal to say I don't know. Now, when I teach you something, and it's the following week, and we have a similar patient. And then I ask you, what should you do? And you repeatedly say, I don't know. Now I'm starting to say, okay, you're probably not retaining the information. And then you start thinking, oh, this guy's, guy or girl's not smart or whatever. All that to say is try and learn from each and every one of your experiences. Sometimes I recommend this. Sometimes I recommend staying late and just researching the cases that you saw. If you like internal medicine, we after we sign out, I usually would go back to my room, my office, or the lounge, and I would just look at all my patients that I saw that day, especially when I had no idea what happened that day. Like as an intern, I'm not gonna lie, you're gonna present on patients, and you had no idea what was going on with that patient or whatever. Just your senior attending helped you out, and you just said yes, and then you kind of just did whatever they told you to do. I highly recommend you go back and learn from the patient and figure out like what exactly was, you know, the underlying etiology of what was going on? What was the pathophysiology? Can you identify based on their clinical features? Again, if that patient were to come in again, what, like, would you have that broad differentials that you had again? You know, develop your own algorithmic approach for handling patients. You know, like shortness of breath is a general term, but if I see someone come in for shortness of breath, I have like, I have a cardio bucket, I have a pulmonary bucket, I have an endo bucket, I have a malignancy bucket. Yeah, I have all these buckets that I've developed over time by just seeing so many patients, and learning from the patients that I've missed, like their diagnoses. So yeah, to answer your question, dude, early on, it's okay to say, I don't know, like, it's all right, but then go and research it later, because you're probably going to see that same thing that following week. And if you repeatedly over time continue to say, I don't know, then they're eventually going to be like, man, that guy doesn't know. Does that make sense?
Yes, it does.
Yeah.
Thanks. Thank you.
Yeah.
Anyone else has some questions? You can go ahead. Raise your hand.
Now, don't bite. You know, something that I wish I knew, I think we were talking about like technology or things that resources per se that I think really helped me out along the way. Up to date was really a good, it's like a bare minimum thing that you should know. Like, so if someone comes in and they're presenting with whatever pathology, and you like get a diagnosis of pneumonia, typing in pneumonia and up to date, it will give you like how to diagnose it. It'll give you the first line and second line management. It'll give you like the complications to worry about. And honestly, you can put that into your assessment and plan. Like, and people will think you're smart, to be honest. Like, for the most part, they'll just be like, oh, wow, how'd you know that? And you're like, yeah, like, yeah, it's, you know, 5% of people will have pneumonia, you know, like just literally reading off it. So knowing how to use your resources is also very important. So up to date was a good one. MD Calc was another one for me. In medicine, we do a lot of calculations. So many calculations, and like we're correcting for, you know, potassium and magnesium and sodium and those kind of things, glucose, Winter's formula, you know, all those kind of things is very important. I know in ED they do the heart score, like that is like, that's the bane of my existence. Yeah, it's if anyone with a positive heart score, no matter if their tropes are negative and their EKG is fine, like your calling cards is like, you cath this guy, you know. So like so like know that. I think for ED, I think you guys do edcrit.com. It's something like that. I can't remember off the top of my head. There's a website that
we do, yeah, Wiki EM.
Yeah,
that's
exactly.
yeah.
I look at that too. I'm not gonna lie. Like, from a critical care standpoint, I love that stuff. It teaches me how to like intubate, like what RSIs and like ketamine, how much ketamine to give, how much propofol, those kind of things. But that's a good resource. Like I said, up to date, bare minimum is a good resource. MD Calc is a good resource. Man, I'm trying to think of some other good resources. I know there's a couple, like if you guys are trying to do like deeper research in terms of like what is going on, like up-to-date medicine, those kind of things, I would say, you know, there's like PubMed always has some good articles. New England Journal has always some good articles that you guys can, you know, keep yourself fresh and updated. Doing questions for us is MixApp is going to be a good resource. Those kind of things. I'm trying to think. Those are like really the big resources that you like can barely bare minimum use. That I think you guys should, you know, definitely know about.
Yeah, I really like that advice, because I feel like as a med student, one of the things that like I would do a lot is I'd want to like search things up on my computer, but I feel like, oh, like maybe you guys shouldn't, because it maybe looks like I don't know what I'm doing. But then I'd look around and I'd see a lot of like other residents doing it. I see like attendings going on up to date all the time.
Yeah.
So I started to get like used to the fact that like, hey, you should normalize this, right?
Yeah.
Like, it's a tool that you should use. Like, there's no reason why you shouldn't use it. Even if you already know the answer, you just want to double check, like, why not?
Yeah.
So I think really like normalizing like the utilization of those resources is very important, and that everyone should definitely get comfortable with.
Yeah.
So I definitely really like that piece of advice.
Yeah, no, and I love that. You know, with AI being a really big thing, and I'm really a big proponent for AI. I will say I can see some downsides of it moving forward. I feel like understanding that AI is a tool, right? And so you have your own thought process, and then based on that thought process, you use AI to supplement your learning, not using AI as a primary resource and like this is like how I'm going to do those kind of things, because that's a very slippery slope from that standpoint. But for me, I'm not going to lie, I use open evidence during rounds. Like if I have a pathology and I'm like, man, like I have these differentials, or I see like a weird rash or something like that, I type it in open evidence. I'm like, what do you think? And it'll give me like these weird malignancy, like vasculitis or whatever. And honestly, it's kind of guided a lot of ultimately I have to make the decision to pick one of them or none of them. But I think that's very important to start using artificial intelligence. Honestly, it can help you write your papers too. Like for a research standpoint too, that's another thing, man. Like the game has changed. When I was an intern, we didn't really have ChatGPT and those kind of things. I think it was like starting to be a thing, but like not as popular. So like I was up all night writing like one paper, and ChatGPT became a thing, and now, dude, millions of publications are coming. Like it's very easy. Don't copyright or anything like that, but like it's a good, like it comes like with a good format and those kind of things. So yeah, man, definitely use it. Open evidence is definitely another good resource, I would say, and definitely normalizing the fact that even attendings, like you said, will look up to date because you can't remember everything. Like there's no way like that.
Yeah, no, exactly. And I think we have another question from Katarina asking you, how is the ABIM? Is it like STEP?
Yeah, so I haven't taken ABIM yet. I'm going to take it in August. But in terms of preparation, it's pretty, it's not too bad. So there's two big Q banks that you can do, which is your mix app. And I think every program is different. For our program, we have to do at least 1,200 questions. So I finished that already. I wasn't really a fan of Mixapp, to be honest. Not dissing Mixapp. It's just I didn't personally vibe with it. I'm doing UWorld now. I'm almost done with it. And honestly, I love UWorld. Like I'm really a big UWorld person. And I feel like at least talking with some of the seniors above me, they were saying like those are like kind of similar to how the questions, the styles of them. So, and they're not as difficult. It's not as difficult. Like Mixup, I feel like was a lot harder than what ABIM is supposed to be like, is what a lot of people are telling me, versus UWorld is around the same pillar of strength. So yeah, I haven't taken it yet. I'll let you know though, as soon as I take it in August though.
Just getting to the hour mark here soon. So any final questions, I'll let you guys go ahead and ask. We are recording this, so we will send you guys a follow-up email once we have the recording process, and we'll also write down some of the resources that Matt talked about. So just a heads up. But yeah, any final questions, I'll let you guys kind of toss it in the chat here. Any tips on working through fatigue, Matt?
Oh man, I don't do coffee. I'm someone who's like I refuse to do coffee. I think I'll leave it at that because I'm sure there's a lot of coffee drinkers in here. I don't want to get beat up. But finally someone said, right, right. Yeah, man, I'm not a big coffee drinker. But with that being said, I know probably 95% of like residents probably drink coffee or tea or something like that. So that's probably one thing for me. Like I said, I'm big on like my faith. That helped me get through it. Having like my girlfriend was really important for me. She helped talk me through a lot. My parents are big helpers as well, like big support systems. My brother, my friends outside of medicine. It's actually comforting because they don't know medicine, and sometimes like you'll come home and you feel like dumb about something, and then you talk to them about, like a central line, and they're like, what the heck is that? And then I'm like, oh yeah, I am smart. Like you kind of get like a little boost, so that's or anything medicine related, which was cool. But yeah, you kind of just grind through hard days, unfortunately. I will say this, I think I am someone who prioritizes my mental health, and I think that's very important. It's not something that's openly talked about, but like if you are having a day where you feel like it's like a crippling day. I've had those days where I couldn't even get out of bed. Please call like your chief or your attending or whatnot and have them cover your shift for you. Like this is a job, but like, 20, 30 years from now, we might be doing something else. So like, don't risk your mental health for the sake of this job. Like, there's other equally qualified people, you know, in your class who also can help you out and take over your workload for that day. So I'm a big advocate for that. So please, don't risk your mental health for that. But yeah, otherwise, working out is super important. I mean, yeah, I used to work out in the morning before my shift, and then as I'm getting older, I'm like, I can't do that anymore. So like now I'll work out at the end. I just got back from the gym actually just now, but that kind of actually helped me with my fatigue. I don't know, man. Vitamins, you're going to be inside all day, so like I'm big on like a vitamin D supplement. Those kind of multivitamins that kind of helps get my energy up. Yeah, man, I don't know. Other than that, yeah, I mean, I guess the Celsius and the coffees and the caffeine cookies or whatever you guys are eating or whatever, those things can also help, I'm sure, but those are lower on my to-do list.
Yes, Katerina, we will drop our contact information in the chat just as we're about to conclude. Quick question for me, Matt, might be kind of a funny question. I've had some time off now, so I've been like pretty much kind of bored and just like I've been doing a lot of like working out and stuff, and I would like to keep up being healthy during residency.
Yeah.
And I know there won't be a lot of time to eat, and then when we do eat, I've heard a lot of people just like binge to try to like fit in whatever they can.
Yeah.
What are some of your top snacks that you eat that are healthy and that kind of keep you going?
Yeah, man, I'll be honest. So I like honey roasted or like peanuts. Like I do like a handful of peanuts throughout the day. I'm like a carrots guy. I like the crunch, those kind of things. I'm like a weird dude. Crunch or carrots, apples. I love green apples, grapes. I just started getting into dried mangoes. That's like now my thing. Be careful though, because those have a lot of carbs. Like you have to be very careful. I think I compared it to like a bag of like Sour Patch or something like that, and those like kind of equal. And I was like, oh man, I got to be careful with this. So, but yeah, dried mangoes. I think I do a lot of mandarins, like the little small ones, just kind of snacking.
Those are my favorite. I love those.
Yeah, I love those.
So easy.
I'm like pescatarian, so I don't do I just do seafood, but for the most part, I supplement with like tofu. I love tofu. You can prepare it so many different ways. Invest in a what are those the air fryers, please. If there's that's probably I should have started this whole topic with that. You have to invest in one thing. Your first paycheck should go towards an air fryer. It is the most clutch thing you can ever buy in residency. And I will say, like, I meal prep because you'll know, like, you at least get 1 day off a week, at least 4 days off in a month. So that day, if you know it's coming up, meal prep that day. It takes, it doesn't take too long, maybe like an hour or two. Meal prep for that whole week. So that way you can stay consistent with your diet. I think that's very important. For me, it was like, I have a very comfy place. And so I know, like, if I come home, I'm not getting off that couch. So like, it's impossible. Like, I've made it that way, unfortunately, that like, I don't want to leave. So I will bring my stuff with me to work. So I'll go straight to the gym right after. I don't come in my place at all. When I come in here, that means I'm in my shower and I'm going to sleep or watching TV or whatever. So that's like little mental stuff like that is very important. I also don't take work home for me. Like, I don't have any, you can use like on your phone, you have like updates from work or whatever, the epic chats, or we call them. I don't do that. Like if I'm off, I'm off. So I think that plays into like my diet and everything like that, because stress makes you eat unnecessary things.
Right.
I think so. Yeah, I think other than that, I'm trying to think of some other stuff, but yeah, just the fruits, man, the veggies, trying to add some fiber in every meal that you can. Clean up that colon. Yeah, 40's coming up. Yeah, I think that's honestly just a big thing for me. And there's a lot of good online workouts too. Like, I think even was it Netflix? I use a lot of YouTube videos, like on days where I just can't, man. Like, I'm just mentally drained, but like I need at least a good 10-minute, quick hit workout.
Right.
I follow a guy on YouTube, and he has like quick workouts. I do a quick ab set or squat set or push-up set. And that gets me sweating, those kind of things. And I feel good about myself at that point. I'm like, okay, cool. Like, I'm good now. But yeah, that's kind of how you just have to stay consistent in those kind of like diet recommendations.
Awesome.
I think there was one last question we had from Mexon that was asking any tips on patient presentation and how to master it.
Yeah, man, I mean, just consistency, just getting involved in like consistency and like just keep practicing. So like for me, it depends also if it's a new patient or if it's a established patient. So for a new patient, honestly, you should always go through the whole HPI in terms of, you know, hey, this is a 40-year-old man. And then I give a quick what they're here for. So that way it kind of clues me into like when you're talking about past medical history and those kind of things. So I'll say, here's a 40-year-old man who's essentially here for COPD exacerbation, right? So now I know, all right, cool, this guy's lungs suck, right? And so when I go to my past medical history, it's relevant for my COPD. So, you know, past medical history of tobacco use disorder, and you know, alcohol use disorder, and sarcoidosis, you know, basically, you know, the whole nine of like what happened from start to finish. And then you kind of just get into your system in terms of subjectively your SOAP note, essentially, right? So subjectively, not complaining of anything or complaining of shortness of breath, those kind of things. Objectively, always do your vitals. So vitals are, you know, blood pressure, X, Y, and Z. He's on 2 liters of oxygen or he's on BiPAP. These are the settings. Get to your physical exam, things that are relevant. So obviously for COPD, you want to do heart and lungs. So lung sounds, X, Y, and Z bilaterally. After that, you want to get to your labs. So relevant labs, I'm looking at my ABGs. I'm looking at my glucose monitor just because usually you're loading these people up with steroids, right? So I'm trying to think. Otherwise, yeah, making sure they're not acidotic. And then you get your images. So any new imaging, your chest X-rays, your CTs, all those kind of things. After you do all that, you've synced it up. They're ready for you to present your assessment and plan, and you get straight into it. So based on your assessment, hey, this patient, again, you can do a quick summary: COPD exacerbation, secondary to noncompliance, or, you know, community-acquired pneumonia. My assessment based on, or my plan based on that is, you know, I want to talk to pharmacy to make sure he has the right medications, talk to pulmonology, make sure he's set up outpatient for PFTs and follow-up. I want to treat with, you know, community-acquired pneumonia. I want to do a unison and vancomycin and get blood cultures, those kind of things. And that's pretty much it. And that's like a new patient. For established patients, it's very simple. It's just a one-liner. You would just say, this patient, this is a 40-year-old guy who's here for COPD exacerbation. He's on day 2 of prednisone. And then you go right to overnight events and then your SOAP note. And then it's kind of easy from that standpoint. But I like that pathway. I'm sure if you talk to some other people, they'll give you others. But for that, I always follow my own algorithm and I never miss anything from there. So I would say, like, listen to other people present, listen to your seniors present, listen, talk to you. And your attending is going to you're going to have different attendings who want you to present several different ways. And it's going to be frustrating, to be honest. But, you know, just ask the attending up front, how do you want me to present? Because I like to present this way. And usually they're like, yeah, cool. Otherwise, they're like, all right, I want you to add this into that and whatever. But yeah, I don't know. Hopefully that answered, you know, your question.
Yeah, awesome. Well, yeah, thank you all again for being able to join us. We're at the hour mark. Again, Matthew, thank you so much for being able to join us on this webinar, as well as Roche. Really appreciate it. Again, everyone will be sending you guys kind of like an email recap of all like the resources that we talked about, as well as our contact information if you guys ever need any help. And again, thank you all so much. And yes, we'll also be linking that website as well that Matt just dropped.
Yeah. Thanks, guys. Appreciate it. Best of luck.